I'm Kerry Fink with Helping Seniors Updates on behalf of our president and founder, Joe Steckler, and Kim Bernard, our education specialist, who you will find as the friendly and comforting voice of the other end of the Senior Information Helpline, 321-473-7770, 321-473-7770. You'll want to welcome you to today. Today is Friday. It is the 3rd of July, and this is Helping Seniors Updates. We do these every Monday, Wednesday, and Friday to give you some insight into the things that are going on in Brevard County, and particularly as we move into this holiday weekend. It's the 4th of July weekend, so we hope you're going to have a good, enjoyable, safe celebration. And that was one of the reasons why I'm so grateful to Traci Graf, who is our guest today with Avid Home Health Care, because not only is she experienced in safe home health care, but she also has a tremendous career as a registered nurse in some very, very complicated situations. And I believe, Traci, you're going to have some good advice for us as we think about doing the 4th of July weekend safely. How are you today?
I'm good. How are you?
I'm well. So tell us a little bit what's going on. We see these numbers rising. It's a little bit frightening to those of us who don't understand it, as I guess it should be, and really want to know what are the things that you're experiencing and what advice you have for us throughout Brevard County about the things that we would want to do to make sure that we're safe and keeping our loved ones safe.
Well, Kerry, anyone who lives and drives around Brevard County knows that we are not doing very well with social distancing. Mm-hmm. We are not. The rivers are packed. The river edges are packed. I live in Merritt Island. Any up and down any causeway on or off the island, they're absolutely packed every weekend. The beaches are packed. You know, the restaurants are busy. It's really, really scary. I don't know what we're doing. We are taking every precaution that we possibly can to prevent any of our clients from being exposed. And we're doing well because no one has been exposed, not client, not employee, not family member of client or employee. Mm-hmm. So we've had no positive testing done on anyone at all. We did have one employee that was tested. She thought she had been exposed, but she had not seen any clients between the time that she thought she had been exposed and we had her tested. And she didn't go back until her testing came back negative.
You know, Joe and I, we did radio this week. We were back in the studio, but we did it, with social distancing. Of course, everybody is wearing their masks and doing all the precautions. But I made the observation, not as an expert, but just as a consumer, really, going to the CDC website. Now, remember when we first started doing Helping Seniors Updates in March, we went to the CDC website for guidance. What are the things that they recommend that we should be doing to stay safe? And then I went back to it as we were doing the radio show Wednesday, and those really haven't changed.
Yeah, I mean, they've been consistent in their advice to people. Keep your distance, wash your hands, wear a mask if you go out in public. If you have any symptoms, good Lord, stay inside. Just stay inside. We hear all sorts of crazy stories. People going to work knowing they're positive. I get that it's really a terrible situation. I mean, if you work in an industry where you don't have paid time off, you can't get unemployment quickly, you really could be in a bind, even missing a week of work. So, but we have to be vigilant about it, and people have to get back to really stopping with all the other conspiracy theory stuff and just focusing on stopping the spread of this. It really is not that hard. We could really reduce the rate by, like I said, wearing masks, keeping your distance from people, and washing your hands.
Well, and that's what occurred to me as just as a person, just trying to interpret the data that we're being given about how to stay safe. And it really does seem fairly straightforward because, like I said, the CDC guidelines hadn't changed from what I remember seeing when we first started doing this. But it does seem like our attitude generally has changed. Like we're less concerned, like somehow maybe we got more concerned about other issues, and then we just forget that this thing is still out there. And it's just like, it's like we need to return to that common sense approach of let's treat this seriously and let's be careful. And we can still do things, but we need to do them with an understanding of all these things. And the very fact that you, as Avid Healthcare, and I think I mentioned I was talking with Sharice Durham with Hibiscus Court, and they mentioned that to date they have been able to accomplish the same thing of staying 100% COVID free. It does show that if you're diligent, you're able to keep that wolf at the door.
Yes, and it's not for lack of busyness. We are insanely busy. I don't know where it's all coming from. Obviously, we're grateful for it because, you know, we all love what we do, and I am very grateful that I'm able to keep all of my employees working through this. So, you know, that's been another side of it as an owner and a boss that I've tried to really sort of help. I've tried to help my employees understand that staying employed right now is a two-way street. You know, they need to stay healthy so that we can prevent them from spreading it to any of our clients, and they can stay at work. You know, because most of them are per diem worker, they don't get paid time off.
Right.
So if they're off, they're really in a bind. And you know, I'll give you an example that happened with one of our clients the other day, and I actually was very disturbed, I guess is the word I'll use. We have one of our clients is just very elderly couple, of course, very frail health, especially the one of the couple. And she is on service with one of the hospice services. And we had to make a call the other day to have the hospice nurse come out for a complication that needed to be addressed by them. And the hospice nurse came, and she proceeded to come into the house and never washed her hands, never, not once. Including, unfortunately, putting in a Foley catheter. Never washed her hands when she came in the home, not before she touched the patient, not before she put gloves on, and not after either. Obviously, I made a call to that agency to say that I was very displeased with that kind of recklessness with one of our clients. I'm sure they weren't happy that I called. It was kind of a nurse-to-nurse call saying that, you know, we go to extra efforts to make sure that we are keeping these clients safe. And this is a couple that has 24/7 care, so we are there all the time. And, you know, my employees, that's the first thing they do when they walk in the house is they wash their hands. The first thing they do before they leave the house is they wash their hands. As I've told them, that is really our number one defense for bringing something into someone's home or taking something out of someone's home to the next place. And I think the fact that we've gone since March and we've been busy and we've taken on more clients and we still have not had any infections, I think speaks volumes for how well my staff are handling this.
Yeah, and it's so important because I remember we got into this discussion on the radio show Wednesday. Our guest was Bill Johnson, who's a board-certified elder law attorney, and we were actually talking about technology in the law. But in the course of the conversation, we had a sidebar discussion about wearing masks, and I said, you know, I'm not an expert, but everything I can read about this is that you're wearing the mask because maybe it's going to help you some, but at the same time, it's certainly going to help you to keep the people around you safe. And so what you're saying makes so much sense about hearing how you guys are extra careful with every precaution, which is, I think we had this conversation before the camera for the Helping Seniors update was rolling, but you were saying, you know, really that people, these are probably things that we should have been even that much more attentive to just along the way.
I mean, I don't know that mask wearing. I mean, I said to my husband the other day when I put my mask on to get out of the car and go in somewhere, I said, I mean, I worked 16 years in the OR and I wore a mask the entire day. It was natural to have it on. And I said to him, boy, if you had told me back then that there'd be a day in the future we'd be wearing masks every day outside of the OR, I would have said, there's no way. But here we are. And I think that, I honestly think that keeping your distance from people and not going to places where there are crowds of people and you are in close proximity with other people, especially closed places, I think that is as important as wearing a mask in public. I really do. Yeah. And washing your hands. I mean, I've seen some absolutely terrifying things with people with gloves on. The people who are out in public with gloves on should take them off.
Yeah, that is an issue. That's an issue. You have to keep those hands clean, right? So let me ask you this. Are you guys, because it's always part of what we want to ask people as we're talking to different businesses who are located and helping seniors on the Space Coast. So are you guys open for business? Can somebody give you a call? I mean, I know it's a new patient.
Yes. The phone really has not stopped ringing, honestly. It's been a steady stream of new clients, clients looking to switch agencies. I don't ask who or where or why. I just do whatever they need. But there's been a lot of that as well. So I'm not actually sure what's going on around, but I'm too busy to be worried about it.
And how do people get in touch with you if they want to get in touch with Avid Home Health?
They just call the office number, the 321-392-3400 phone number, and we're always available. If we don't answer, we're either on another call or talking to a client. Just leave a message, and one of us will call you back. Avid is run by myself, my husband, and our son joined us in March as well. To be sort of administrative in the office and help. So clients may expect to talk to one of the three of us.
Sure.
But we're all committed to the same thing. And, our team is growing and growing and growing. And I'm really proud of the fact that we've gone this far into this crisis and that we're handling it well. We have not taken any clients on at all that have come out of the hospital with COVID either. So, we are selective in, I guess, some of the new clients we're taking.
Right.
But for the most part, it has not been people who had anything related to COVID or hospitalization for COVID that have been calling us.
Right. So I guess this is a question that I wanted to, or it's a statement actually I wanted to make if you're watching this, I want you to find the Helping Seniors YouTube channel. You can go to the Helping Seniors YouTube channel. You can also visit the Helping Seniors website, which is helpingseniorsofbrevard.org, to access, because there's a couple of great television shows that I've had the privilege of hosting together, interviewing Traci. There's one really good about mental health for seniors, which I guess is another issue that we face at this time with the isolation and everybody telling us to be careful and stay at home and do those kind of things too. So I really want to invite you, if you're watching this, to have a chance to take a look at that. And Traci, anything that you would want to add to that comment?
There are definitely more mental health issues right now. People are anxious. People are on edge. They're scared. I get a lot of calls from clients asking questions, just wanting some reassurance. Actually, I got a call last week from a client who was concerned because she had heard her caregiver talking about going to a birthday party.
Oh, right.
And she was concerned, and rightfully so. So it turned out she had been talking about it, but she had actually decided as the numbers started to climb to not go. Good. So, again, I mean, I can't control everything my employees are doing when they're not working, but I can try to be an influence on them that helps them understand why this is so important.
Right.
And I will tell you, Kerry, they get it. They all get it. they get it. And they, you know, I find that, I mean, all that stuff I found out about the nurse not washing her hands, I was told by that person's primary caregiver.
Wow.
They were very upset.
Yeah.
And tried many times to encourage the nurse, like, here's the hand sanitizer if you need it. The kitchen sink, if you want to wash your hands, is right over there if you want to wash. Never did she take the opportunity even.
That's difficult. That's difficult.
It is difficult. And I have really given my staff permission to, you are their advocate. You are their advocate. If they may not be comfortable saying to the nurse, why don't you have a mask on? Or did you wash your hands before you came in here? But you know what? My people have every right to speak up for the client and say that.
That's good.
We take our responsibility for every client very seriously, Kerry, very seriously. And the safety and security of our clients is our absolute top priority.
So reassuring to hear that you guys are doing the right things on that. And so one more time, the phone number, if somebody wants to get in touch with you and ask a question or follow up.
321-392-3400.
Yeah, well, thank you, Traci, for joining us. I'm going to close out by just giving a quick update on the Helping Seniors Car Raffle. We are so excited that we have a new date. It caught us, much like it did everybody else, totally by surprise. We were planning to have a really great time at the American Muscle Car Museum back in April. And of course, with the governor's restrictions for keeping us safe, we were not able to accomplish that. So we have worked out a new date. It's October 10th. 2020. So as we like to say, if you like lucky numbers or something like that, there must be something to 10-10-2020. I don't know, but it sounds like a fun date to give away the car. And the winner is going to get to choose from a 2020 Chevrolet Camaro, a 2020 Dodge Challenger, a 2020 Kia Sportage, or that lovely fiery red little Mazda Miata 2020 convertible. So in any case, it's going to be a fun day. And we are giving the car away 100% on October 10th. 2020. Our plan is to have the big event at the American Muscle Car Museum. We're believing that the spike that we're seeing will be under control. Worst case, there will be a rain check for the party, but the car giveaway is happening on October 10th. You can get your tickets. One ticket is $25, $5 for a $100 donation, and you can get those at helpingseniors.carraffle.com. helpingseniors.carraffle.com. So with that sort of as a backdrop, Traci, thanks for joining us on this today. Hope you guys have a good, safe, happy 4th of July celebration. Let's follow all the guidelines that Traci was talking about, and let's enjoy it safely so that we'll be in good shape as we get for that to October for that grand prize Helping Seniors Car Raffle drawing. Thanks again, Traci.
Stay home.
And thank you, viewer, for tuning in. Have a great 4th.